if you and your family members are looking for help and you're looking for hospice care, we have the right guest for you today. Her name is Dani. She's with us, and she's going to tell us all about her company and how unique hospice and palliative care can provide services that are very unique and tailor-made for your needs and your family's needs so that there's maximum comfort and a lot of love to the one that you care so much about. Stay tuned. Dani, how are you?
I'm good. How are you today?
Good, good. I'm very glad that we finally got you on the show. I know that you and I met, it seems like it was about 3 months ago, and I was so intrigued by your line of work. I immediately asked you to be on the podcast, but because of the holiday season, it's taken time to get you here.
Yes, it has.
Did you have a good holiday?
I did. It was busy, off and on, but it was good.
Yeah. You know what's funny? I think this is the first year that I'm hearing everybody say the same thing. Probably something that's always gone on, but man, it was so busy. And then it's like we're all happy that it's over with in a way, you know, and that you got back to normalcy, right?
Yeah. I mean, it's busy, but then also like with all the holiday parties and stuff, but then at the same time, from my line of work sometimes and going out, all the doctors are gone and on vacation, so it kind of slowed things down a little bit.
Yeah. In our office, after the holiday, after Christmas, then things get nice and slow.
Yeah.
But it's all those darn parties, man. I mean, I love them all, but man, you could get fatigued really quickly with them.
Yep.
Okay, so let me properly introduce you. So Dani is a native, born and raised in San Gabriel Valley, La Cañada, Flint Ridge, with a theater's arts degree from Loyola Marymount University.
Yeah.
How cool.
Yeah.
Okay. Now, I've got this information off of the webpage from the company that you're working with. It doesn't say anything about you being a former princess of the...
It doesn't. I know. I don't normally advertise that much.
Well, I noticed that on the webpage, they do have your picture right up there. I think it's you. It looks like it. So you're still very photogenic, and they're making good use of your... your looks and everything, so that's good. So with 5 years of festival production experience and over 10 years working in the entertainment industry, you have over 5 years of retail management and stylist experience and 3 years experience as a legal assistant for personal injury law. So you, prior to getting into your current profession, you did a few things. I think that we talked before that you were in the entertainment industry. What exactly was that?
Oh, a lot of different things. I started doing kind of sound and stuff like for festivals and like Coachella. I worked with the Do Lab, and then I kind of had my own little business that I kind of started, and it was showers, and I was providing showers out there at all the festivals.
Oh my God, that's so needed.
It is needed. People forget, like, you feed your body, but you also like need to take care of it and clean it, especially at those kind of events. It's so refreshing, to like the soul almost.
Where were you at Woodstock?
I know. I wasn't born yet. But I feel like I'm an inner hippie.
You should have been there. It's funny. I'm from Chicago. On the south side of Chicago, there's a baseball field. It used to be Kaminsky Park. He used to have showers in the audience. In the summer, those hot, humid days and stuff, and people would go over there. Of course, they'd be drunk and they're getting showers. So interesting.
Yep.
Okay, so after a medical scare in 2018 that left you paralyzed from the waist down, I didn't know about this about you. You were able to regain motor function and learn to walk, fortunately, but it was because of a vitamin deficiency, and it was that experience along with COVID that made you refocus on, what you're doing with your life, right?
Yes.
Okay.
Yeah, so I had to, kind of pivot from doing because a lot of my work was very physical. So I had to step back from that because I know my own strengths and weaknesses, and I wasn't able to do the physicality part of it anymore. So I kind of had to refocus, and I fell in love with like the senior community, I guess.
Well, good, because you and I have something in common. I love senior people. I always have all my life and stuff. And so when I heard that you did this work, I thought that you and I are a lot alike. And so you've decided to focus on people that you really care for.
Yes.
Okay, and through your volunteer work at the Elizabeth House and having that experience, then you've gotten into what you're doing now.
Yes.
Okay, and so when you and I were talking, you said that there's a different way of doing hospice care. I think is what you'd said. So why don't we start off with what really inspired you to get into that? Because that's a lot of people would say that that's kind of sad.
Hmm.
That's the type of work where you're dealing with grieving families. What really motivated you to do that?
I think it's my own personal experiences watching my grandma and my grandpa go through it. And then my dad had recently passed about 4 years ago. So it kind of like I just felt really connected to everything. And I just wanted to, I know my experiences that I had, and there's so many questions, and you're like, as a family, you're deer in headlights, and you don't know what to expect, no, don't know what to do. A lot of times people think like you're just coming in with morphine and then all of a sudden they're gone.
Yeah.
And that wasn't my experience. I watched my grandma be on hospice for about like 6 years. And so it can actually help the families and give them support and also the individual and prolong their life, which a lot of people don't think.
No, I never thought of that either. I always thought that hospice care was solely to give somebody a chance to go home and die.
Right.
And that's not what your definition of hospice care is.
No, I mean, that is part of hospice. Like, we do want to go to their home if we can, meet them wherever they call home, whether it be in a skilled nursing facility. We've done a hotel room even. So, wherever the person calls home, that's where we're going to meet them at and provide the care. And it's all about providing comfort and compassion for them and support for the family as well.
Okay, so the company is called, I'm sorry,
We're called Unique Hospice.
Unique Hospice. And
Yes.
is that based in Pasadena?
It's in Arcadia.
Arcadia, okay.
Yeah. So we just like the name unique, we know that each individual is unique too. And so we really try to personalize the plan of care to the individual and make it meet their needs and the family's needs.
Okay, all right. And so how long has the company been around?
For 8 years.
Okay, good,
Yeah.
good. And what's the stereotypical home care, type of, is it home care or hospice care?
It's hospice
Hospice
care,
care.
yes.
What's the stereotypical model that you're different from?
Well, I think what sets us apart is that one thing is that our director of nursing is also a nurse practitioner. So that helps us a lot to be able to deal with things in a very fast manner and react quickly. So we don't have to always wait for a doctor for them to get in or for the response. We can change the meds, we can change the plan of care when it needs to be done in a timely manner.
So you're saying there's a nurse practitioner on board all the time?
Yes, and then our nurses are 24/7. That was one thing I noticed that I love about our company is that you can always speak to a nurse and get your answers. And even in the middle of the night, you're going to talk to a nurse. And
Okay.
it's not going to be like, oh, you have to wait till they get in the morning or wait a couple days. You'll get your immediate answers right away.
How do you ensure that your caregivers are qualified, and experienced?
Right. So they're not caregivers, they're nurses, RNs and LVNs.
Okay.
So they
Well, let me stop you there. Before you get into that, your service doesn't provide somebody to be there with the patient 24/7, then it's more of a nursing staffing?
If they do need more of that support, we can step in. We work with other agencies too, like home care
Okay.
agencies like Home Instead, or that we could make the connections for them and make that happen.
Okay. So, I'm sorry I cut you off. So
No,
you were
it's
telling
okay.
me, how do you qualify your people to be able to work for your company, the LVNs and the nurses?
So basically, we just do recruiting for like any other company. We go through their resumes, make sure, my administrator speaks with them, make sure that they're the right fit, not just for our company, but for hospice. It's not something that they're scared of too. And then we also train them out in the field as well. So that way they're prepared, because hospice is a little different and you want to make sure that you're talking to the families in the right way and that you have the empathy. I think that's a big part of it too. It's not just clinical nursing, you have to have empathy and compassion too. And that's a big part of our nurses and making sure that they are able to provide that to the families.
That's good. Yeah, you're looking for not only somebody that's highly skilled, but somebody that's highly skilled with people.
Yes.
Okay.
Yeah.
Okay, good. Yeah, I mean, it's such a personal thing. I mean, I had my own experience with my father-in-law passing, and I remember the interaction with the nursing at the hospital, and some of it was good, some of it wasn't so good afterwards and stuff, but I'm glad to hear that you guys concentrate on that. Do you practice solely in California? Does your company only do California
Yes.
patients? Okay.
Southern California, mainly Los Angeles
Okay.
County. Yeah.
And how do people find you?
A lot of times recently, what I've noticed is that it's been word of mouth. Uh, we provide such exceptional care that it kind of speaks for itself, and the families talk about us in the community, and people talk about us. And so we've been getting a lot of our referrals are from word of mouth. But also, part of my job is to try to work with hospitals and skilled nursing facilities and boarding cares and see how we can support one another and build those relationships.
So you get out and you talk to the people in the hospitals and everything, let them know that you're around and available.
Yes. And then make sure that they know about our services, how, we can help them, and what makes us different too,
Yeah.
A lot of times we try to really concentrate on the person and what their needs are and what the family is. So the person can have dual diagnosis, and we want to work with that too. If they have, for example, a diagnosis for prostate cancer, but they also need dialysis, we can work with the diagnosis of the prostate cancer, but still have that patient treated on dialysis. So not all care is being stopped.
Okay.
Yeah.
And does your nurse practitioners actually go to the home sometimes?
Yes.
They do. Okay. So it's not just a remote conferencing or anything
No,
like
they
that?
go to the home, they meet the family, do a complete evaluation and assessment, and create the plan of care.
Okay. So do you know, I don't know if you know this or not, but who makes the decision as to whether hospice can be at the home versus like in a care facility? Because I know from personal experience with some member of my family, that decision wasn't so easy because the patient would love to go home,
Right.
but the home's really not where that person should be because there's nobody there to really care, and it's almost dangerous, versus going to a care facility where there's. So do you know who makes that decision?
That's going to be, it's a lot of times, the nurse practitioner or the doctor, their primary care doctor, or our hospice doctor, because we have medical doctors as well. So that's going to, and talking with the family, seeing what they can do. Sometimes the family is able to have members of the family come in and do that support, so there is someone watching them at home.
Yeah.
But like you said, if they do require more skilled care, then those relationships that we have with our skilled nursing facilities, we work on with that, and we can send them and find a bed for them at a skilled nursing facility, and then that way there is more supervision for them.
Okay. For me, I hate hospitals.
Yeah.
I mean, I think like most people, right?
Right.
I mean, I was recently in the hospital, maybe a year or two ago, and just for a day or two, and it was like, get me out of here. I mean, I felt so out of touch with life all of a sudden and stuff, and I could understand now why people would want to go home for
Yeah.
hospice care, rather than being in a hospital. Sometimes there's not enough time to go home. In my father-in-law's case, he was 87 years old, and he worked all the way up until 2 weeks before he died. He had rheumatic lung disorder, and he didn't tell anybody purposely. He was a really good man. But while he was in the hospital and it was declining, the decision was made to send him back home under hospice, and they even delivered the bed and everything there.
Oh, yes.
Unfortunately, he never made it home and stuff, but I was thinking how that is probably very important to people to be able to go back home and, in a place of comfort rather than right in the hospital like that.
It is. And I think it's less traumatic too. And then especially when the patient does pass, for the family, it's nicer. You don't have like all cops and ambulances and all this like drama going on. It's a lot more peaceful and quiet.
Yeah, yeah.
And then we're there to support them and to just take care of everything, so the family doesn't have to worry about it. They can grieve, they can do what they need to do, and we're there to take care of everything else.
So what else would be taken care of?
Well, it's about coordinating with coroners and mortuaries and that sort of thing.
Okay, so really it's a case management.
Yeah,
Okay.
because we work with social workers, we have chaplains, we have volunteers, all kinds of resources for the family.
Okay. Do you know, what the common like demographic, like age, or even disease that causes people to have hospice care, or is it just
Well, A lot of it is like older, like 65 or basically you have to have a terminal diagnosis and 6 months less basically to live. But there's a common misconception that it's only for the seniors and for the elderly, but it's not. There are young people that have cancer and that have to use hospice, or there are people also that are, a lot of people think you're bedridden, and that's not the case either. There are people that are older and they're driving, but they still have that terminal diagnosis, but they're still moving around and
I didn't know that.
on their feet, but they can still be under hospice care.
Okay.
Yeah.
Okay. Wow. So one of the things that I've learned about your company is that you do more than just the hospice care. You do what's called palliative care. Something that's a word I've never heard of before. So tell me what that is.
So that's when they're not quite ready for hospice yet, they can still seek curative treatments at the time, but they're kind of getting there, and it's a chance for our team to come in, start providing care, and then kind of get used to us and what it's going to be like, and we can slowly start transitioning them into hospice.
Okay. And is that type of service used a lot? I've never heard of it before.
Sometimes. Some hospice companies don't offer it. So we're lucky enough that we're able to provide both. A lot of times it's not talked about, too, because it's not covered by Medicare.
Oh, okay.
And by insurance companies. So when you're on palliative, we're taking on that expense.
Okay. Now, one other thing about your company that's very unique, and as I said, your company has a very unique set of services.
Yes.
It has to deal with
The LGBTQ community.
Okay, talk to us about that.
So we are in the process of getting our whole team trained by SAGE. So they'll be trained, certified, and that way they can deal with the LGBT community, because we know that's a very big community that's not always, or that's underserved, basically. And we want to let them know that there are people out there that see them, that hear them, and that we're here for them too. And we're here for their stories and to take care of them. You know, it's very important these days, I feel like, to make sure that they're comfortable, even at the end, that we're using the right pronouns and things like that.
Right.
You know?
And they're given the dignity that they deserve.
Exactly. And a lot of people, especially this day and age, and as they're aging, might have some skeletons in the closet or things that they're scared of, or they haven't talked to their family yet that they are not comfortable with. But we want to be able to give them that opportunity.
And what about payment for the type of services? Is there Medicare or Medicaid or anything
Yeah,
like that?
so it's insurance, but so a lot of it's Medicare or Medi-Cal.
Okay, and then of course, if people have private insurance, that helps
It
big
does,
time, right?
yeah.
Well, in the time that you've been doing it, tell me about, what makes you compassionate about it?
Well, I just think seeing how my team works and how much they care too, and will go out of their way for people in order to help them and in order to help the family, and for their last wishes too. For instance, we had a patient who wanted to go visit his hometown, like back east, and we were able to coordinate with another company, a hospice company out there in his hometown, for him to go and make that last final visit and then come back. So really,
Was he able to do it?
yeah,
Okay, good.
yeah. And so really, just like I keep saying, it's all personal, and it's going back to the
Yeah.
person and seeing what their needs are and how we can help them in their final days and provide that sense of comfort. It's not just comfort physically, it's also mentally as well.
Yeah. Do most of your patients know that their days are numbered?
I think so. I think the hardest part isn't what I've seen is the family accepting it. And I think that's always the biggest thing. A lot of the hospice patients on their own have come to terms with it and are okay and ready, but it's the family that doesn't want to let go, which we never do. We never want to let go of our loved ones.
Yeah, yeah. Now, are you working just remotely, or do you go into headquarters and interact with people from the business and stuff, or are you kind of out there by yourself doing what you do?
I go everywhere.
Okay,
I
okay.
network and I go out everywhere.
Okay.
I'll meet anybody where they need to meet. I like to offer myself as an educational resource too. A lot of people have questions or they just don't know, and it's a scary subject, and they look at us like we're the Grim Reaper coming in, and I want to,
yeah.
dispel that and
Yeah.
let people know that it's not like
It's about
that.
love.
It is.
Yeah.
It's all coming from the heart.
Yeah. The reason why I asked that question is I'm a former police officer, and now I'm a family law attorney, and our jobs as cops weren't that different than what I'm doing now, where we get a lot of reward from helping people,
Yeah.
and stuff. And even when people don't realize how much we care about them and stuff, we know what effort we gave to them, and we're really a lot of times that's the real benefit of doing what we do. And I could imagine that that's the spirit of the people that you're working with.
It is. One of the things that I get sad about is when we bring somebody on and they're only with us for maybe an hour or a day. Like, that breaks my heart, because I know that if we could have stepped in sooner and maybe helped them and provided some of that care and comfort and just no pain too. Like, that's the other thing, making sure they're not in pain. And
When you say you meet them for like an hour, is it usually at the hospital?
it depends on, it could be at the hospital, it could be at their home.
Okay.
Sometimes, the family has figured out and they have a hospital bed in the home and they're already bedridden and at home, but it all just depends.
Yeah. So when you meet them in the hospital and you give them the good news that they're going to go home, do you tell them, about the services you provide? And that's good.
Yeah, of course. And we want everyone to know, especially with hospice, that you have a choice. A lot of people don't even realize that. I think it's important that you do your research and get to know the companies and see what fits best with you and what aligns with your family values and the hospice values as well.
So what kind of choices would they have?
Well, choices with hospice is what I mean, because a lot of times you'll go to the hospital or something and they give you a company and you're like, oh, that's it. That's all, the only one I know, and that's where I need to stay, and people don't know that there's lots of different companies out there, and they all can offer something different.
Interesting. Okay. Well, this has been really fun. I really always wanted to talk to somebody in your field, because of the fact that, like a lot of families, I've experienced, some of this. The most recent was my father-in-law who didn't make it to hospice.
Yeah.
And now I have a mother-in-law that's in her mid-90s, and she's in a care facility and she needs hospice. And what was interesting a lot of times is people don't realize how much they need the extra care until they start getting it.
And it does, because when we step in, they sometimes do live longer because of that, because they're getting that extra care, because somebody is checking in on them, making sure their nutrition's good. All of those kind of things can help prolong life. We're not necessarily there not to prolong life.
Right.
Obviously, it's no curative type of treatment, but that all depends too. We've had cases before where somebody's lungs were getting filled with fluids, but we focused on the primary terminal diagnosis, and we're able to clear his lungs. And a lot of companies won't do that, and they shy away from that. They look at that as curative, but for us, it's about comfort.
Comfort, yeah.
Yeah.
Cool. Okay, great. Well, thank you very much for joining us, Dani. This was very informative, and if people want to find you and get your services, how would they do that? How would they contact you?
They can always call me. My cell phone's always on, and so they can call me on my cell phone, which is 626-899-7254, or they can just Google us, Unique Hospice. We're the first one that comes up online.
Cool.
And visit our website. Our website's www.uniquehospice.com.
Excellent. Thank you very much.
Yes, thank you.
Okay.